Good morning. Good morning. I'm Jeanne publisher of The Hill. Welcome to this morning's briefing, America's Opioid Epidemic, Strategies for Prevention. I'd like to thank our sponsor, the Pharmaceutical Care Management Association, for making it possible. This fall, The Hill has hosted a series of events focused on the opioid crisis and the nation's response. This morning, we are continuing the conversation by examining strategies that could prove effective in preventing it from growing even further. The President's Opioid Commission put out its final report last week, and in it contained 56 recommendations for how we tackle an epidemic that is claiming thousands of American lives. In light of that report, we will examine the multi-pronged approach public health officials have adopted and to ask what more can be done. On the program today, we will hear from lawmakers, health officials, medical experts, and patient advocates about steps that need to be taken immediately to address this crisis. Before we get started, just a few notes of housekeeping. In addition to those of you here today, we are also live streaming on thehill.com. We ask that you keep your phones on silent, but we encourage you to join the conversation on social media. You can follow us on Twitter at The Hill Events, and you can comment using the hashtag Strategies for Prevention. We're going to be taking questions from the audience during the program, so keep an eye out for members of the team with handheld mics. And finally, there is a short survey on your chairs. We would love your feedback, so please do fill that out at the end of the program. So let's dive right in. We begin this morning with the senior senator from New Hampshire, a state that has the second highest rate of overdose deaths in the country. Senator Jeanne Shaheen, a former governor of New Hampshire, is a member of the Senate Appropriations Committee. She has been a leader in Congress on the opioid crisis. Welcome, Senator Shaheen. And joining her on stage is my colleague, The Hill's editor-in-chief, Bob Cusack. Bob, I'll turn it over to you.
Thank you, Senator, for joining us this morning. Thanks, Johanna. Just want to start with news of the day. The big political event today is a big governor's race. There's one in New Jersey, but the one that people are focusing on is Virginia. Are you confident that Ralph Northam's going to win?
Well, I'm never confident until the votes are totaled.
Yeah,
and it's a very close race. So everybody who's from Virginia, I hope if you haven't voted, vote again. You know, we'll see. I've been watching the ads, and I have to say, it's been an ugly campaign. I've been disappointed in the negative ads and going after Ralph Northam on things that are intentionally designed to scare people.
Okay, so President Trump, he stopped short of declaring the opioid epidemic a national emergency, instead a public health emergency. What does that mean? How does that impact New Hampshire? And do you think that he went about it the right way?
Well, I wish he had declared it a national emergency. The recommendations from the commission that he appointed were to declare a national emergency and to have the Secretary of Health and Human Services declare a public health emergency. And I think that would have been important in further mobilizing people to address the epidemic. You know, in New Hampshire, we have the second highest rate of overdose deaths in the country. We have the highest rate of deaths from fentanyl in the country. It's devastated families, communities, whole communities are affected. Everyone knows someone who has died because of an overdose. And so we have to appreciate the impact this is having and put all the resources that we can to bear to address this.
You mentioned the commission report. What is your view? It's very comprehensive, a lot of recommendations, and where do you see it going from now, both from the administration standpoint and Congress?
Well, I hope we will take up those recommendations. I hope the administration will put in place the variety of recommendations that they made, and I support what the commission did. I think it's important. I think the more attention we can get to this problem, the better. I wish they had recommended more resources to back up some of the things in the report, but it's an important start, and we need to continue to follow those recommendations and to get more resources. And I think that's one of the things that Congress is focused on.
You mentioned resources, and that's a big issue with this. You remember the Appropriations Committee. There was a lot of talk of opioid money being in the health care, replacing Obamacare, but of course that did not pass. So what is the funding situation? How much is needed? How much is this going to be on the agenda the rest of this year and going into next?
Well, last December, we passed the 21st Century Cures Act, which provided $500 million in 2017 and $500 million in 2018 to address the opioid epidemic. I really disagreed with the formula that the Obama administration came up with, and unfortunately, the Trump administration has continued that in the way that money gets distributed. When Congress passed the dollars, they urged that they go to those states that were most affected, and basically it's gone on a formula that benefits the most populous states, so that New Hampshire, which is affected tremendously, West Virginia, Maine, some of the other smaller states get a very small percentage of the dollars.
So you're saying that the congressional intent, the administration and the prior administration was not following the congressional intent of that legislation?
I think they have sent the money out mostly based on population with the formula has a very small percentage that goes to the rate of overdose deaths, the real impact that states are feeling, yes.
There has been some frustration on both sides of the aisle with the administration and how it's handled this epidemic. How do you think this administration has done? Some people, as you know, the president constantly said we have a big announcement. We were waiting for the big announcement. And we finally got the big announcement. We had this commission report, but how would you grade them? How do you think they're doing?
Well, when Donald Trump campaigned in New Hampshire, both during the presidential primary and during the general election, he talked about the impact of the epidemic in the state. It's very apparent, as I said. And he said that he was going to address that. And unfortunately, he hasn't moved fast enough or far enough, I believe, to really make the kind of impact that we need on this kind of national health emergency. And that's what it is. You know, we're losing about 64,000 people a year from this epidemic. And if we were losing that many people in some other public health emergency, we would have addressed that by now. But I think it speaks to the way that many people still think about this, and that is as a moral failing. You know, if you're misusing substances, then there must be something wrong with you, and not appreciating the addictive nature of opioids and what that's done to make this such a widespread problem.
What are the solutions? I know you've authored legislation and co-sponsored other bills. What needs to get done, and what is the time window of when this epidemic will really get on, where policymakers can get on top of it?
Well, the good news in New Hampshire is that if we're continuing on course, we're going to see the death rate drop about 6%. So while that's not a huge number, that's positive. And
is that this year compared to last?
That's this year compared to last year. And that speaks to efforts in communities and the support that has been provided. The number one most important change that Congress has made to address this epidemic has been passing the Affordable Care Act and requiring treatment for substance use disorders and for mental health issues. In New Hampshire, that's what's provided treatment for people, the expansion of Medicaid. And if that goes away, then not only will treatment go away, but the pipeline for people who are working in this field also goes away. So it's had a huge impact. Now, we've also provided funding for prevention, for recovery, because like any other chronic illness, substance use disorders continue. There's not a one treatment and then you're done. You have to continue to provide support for recovery, community supports, and so we've got a lot we need to continue to do.
What can providers do? We're going to have the FDA commissioner out in a little bit, and he's basically put the pharmaceutical industry on notice. How can providers work more collaboratively, and what's their role in dealing with this epidemic?
Well, unfortunately, providers didn't realize that opioids were so addictive. When they were first presented by Purdue Pharma and some of the other big pharmaceutical companies, they were presented as a non-addictive pain medication. This was going to solve all our problems with pain. And of course, it's not turned out to be that way. And so I think the pharmaceutical companies have a responsibility both to help with addressing this challenge and to making sure that providers understand that these medications are addictive and they should only be used where appropriate. The responsibility is also on our medical schools, though. If you talk to many doctors in New Hampshire who have been practicing for a long period of time, they will tell you that they got almost no training around prescribing. And so that needs to change. And prescription drug monitoring needs to be as robust as possible. We need to support those efforts. And we really need to look at this. As I say, there isn't any silver bullet solution. There are a whole range of things that we have to do. And one of the things that I was pleased to see in the Commission report was a recommendation for continuing education around prescribing for medical providers.
And making that mandatory?
Yes.
President Trump has promised a mass media campaign. We've seen these before, debatable of how much just say no from the Reagan administration. But if you have any type of mass media campaign, what are the ingredients that need to go into it? And that would require a lot of money.
It would.
And do you think that is, what is the message on prevention? What have you seen work in New Hampshire and not work?
What I've seen work in the state is people working together. So one of the things that has been very successful, I'll give you an example, in the community of Laconia, which is a small town in the lakes region of our state. If you've heard of Lake Winnipesaukee, it's on the lake. And one of the things they figured out very early is that rather than trying to put people in jail, they needed to get people into treatment. And so they designated an officer on the police force who did nothing but work to get people into treatment. So whenever he found somebody who had a substance use disorder, instead of trying to put them in jail, he would actually try and help them get into treatment. And they've worked with the schools in the community, with the hospital, they have recovery center now, and everyone has worked together to try and address this challenge. And that's what I've seen work the best.
How closely are you working with HHS and the agencies, and have they been responsive to your requests on opioids?
They have been.
Okay.
You know, again, we need to provide funding. So when HHS can only do so much if they don't have the money to do that. And so what we need to do as Congress is to make sure that funding is there to help them.
A little bit later, we're going to open it up for questions, so think of your questions. I do want to ask you, you mentioned the severity of this problem, which I don't think, even though with all the attention on it, still gets enough attention. 91 people dying each day. And these are Republicans and Democrats. Right. And this is across the country. So just in the Senate, have you, it's a clubby institution, but are you working with other senators who have major problems in their state? And what has that collaboration been like?
There is bipartisan support to address this problem. Now, where the support breaks down is around the funding issues. And around health care, as we saw in terms of the effort to repeal the Affordable Care Act. But Rob Portman, for example, he and Sheldon Whitehouse, Rob Portman, Republican from Ohio, and Sheldon Whitehouse, Democrat from Rhode Island, worked together over a long period of time to put together the Comprehensive Addiction and Recovery Act, CARA. They got a lot of us involved as co-sponsors, and they were able to get that done. Again, it didn't have funding with it, so that was a little easier. But the 21st Century Cures Act, which had the $1 billion in it, had a lot of bipartisan support.
Do you think, and the 21st Century Cures Act was kind of like seeing an eclipse? I mean, it was a bipartisan health bill. And do you see any hope for that. You mentioned the Affordable Care Act and how that was so important. And Senator Portman was one of the ones, was kind of the holdouts and looking for stuff specifically on opioids. So in the Republican repeal and replace bill, would they have kept some of those provisions, or would they have been knocked out on prevention?
Well, in the last repeal bill had $45 billion that was designated to go to address the opioid epidemic. And people may know that Bob Casey took that $45 billion and has put in a bill to continue to fund the opioid epidemic at $45 billion, so it amounts to about $5 billion a year. Now, I don't think that's going anywhere, but that's important if it's on top of the health care that's already available. But if you take away the health care through the expansion of Medicaid, through the Affordable Care Act, it's a drop in the bucket to replace that. And the important thing is not just the requirement that you have to provide treatment for substance use disorders, but it's also the mental health component as well. What we know is that so many people who have substance use disorders also have mental health issues. And if we don't allow them to get help for the mental health issues, then the substance use piece is going to keep coming back.
What has been the human toll? I was in Manchester in the fall of 2015, and really a lot of publications in Washington were not writing about it. And I realized that wow, this is such a major problem. So that was 2 years ago, and now it seems there's been a lot more attention on it. But what is the human toll that you've seen at the ground level with effect on families and the state resources?
Well, I'll give you two examples. I was at Catholic Medical Center, which is one of our biggest hospitals in the city of Manchester, the biggest city in New Hampshire. And they were reporting, I had the head, Dr. Volkov, who's the head of the Office of Drug Abuse in NIH. And they were reporting to her about having 7 overdoses of carfentanil in the emergency room in one day. And what they had to do to address it, because this is so dangerous that you can't just, if it gets on your skin, it is a problem and it could be lethal. So they have to come up with all these new requirements for how to address those kinds of overdose patients when they come into the hospital. And the fact that she was really impressed and took back some of what they had learned about how to address this. The other is a friend of mine who's, she and her husband are middle class, or he was middle class, had a good job. Their children were grown, and he had a back problem. He was prescribed opioids for his back problem, and he had been on them too long. The doctor suddenly took him off. It created depression so bad that he went out and bought a gun in the morning, went home and shot himself in the afternoon. And those are the kinds of stories that sadly almost everyone in New Hampshire can tell about friends or family. And you know, that has a long-term impact. Sure. The other impact is on the kids. We have so many children now who are being raised by grandparents whose parents have either died from an overdose or are no longer functional. I have another friend who's an attorney who has his 3 grandchildren because the son-in-law overdosed and the daughter can't take care of the kids because of her substance misuse problem. And he said to me, you know, I just want to live to be 80 so I can get the youngest one out of high school. That next generation is facing a devastating toll. And unless we deal with this, we're going to see that happen to generation after generation. So we've got to get this under control. And that means we've all got to come together and provide resources to help communities and families.
Powerful stuff. Why don't we open it up for questions if you can raise your hand, and we have people with mics, and just identify yourself, and if you can, keep it short so we can get a lot of questions in the last few minutes.
Senator, thank you so much for being here. So just a question about funding. You talked about some of the challenges with 21st century cures. I was hoping you might also speak about the CARA bill and the funding level for its provisions, kind of where things stand with the CR that we have right now and what the outlook is for fiscal year 2018.
Well, CARA, as you know, authorized funding. It didn't actually appropriate any money. And so in the appropriations process, we did increase funding under the Commerce, Justice, and Science Subcommittee, which I serve on, and we're able to get additional funding for CARA. We haven't funded it at the maximum level yet, although the $500 million will help us do that. Now, if we have a continuing resolution, that will affect those funding levels, and we won't be able to get in as much money as we would like. So I'm hopeful that we will get some compromise that will allow us not to just do a straight CR for the rest of the year, but will get us an omnibus package that includes additional dollars.
Have a month to get it done.
Yes,
or at least,
right.
Right up here in the front.
Also, thank you, Senator. I have a brother who's a physician in Conway, beautiful place,
in New Hampshire.
New Hampshire. He tells me about the challenges of the treatment of patients, particularly, as you mentioned, carfentanil. And it's probably underestimated in terms of the cost, in terms of medical care. So a patient comes in, respiratory arrest takes a long time in order to try to recover. It actually takes a lot of resources from the rest of the community. How are you looking at this? And I guess really the question is, there are some who say it's only a problem in New Hampshire, in Ohio, West Virginia, New England, other. But how do you look at it sort of as as a problem across the country?
Well, it is a problem across the whole country. Some places are having more challenges than others, and as you point out, in New England, northern New England, in our rural communities, we have a huge problem. You know, I was down at the border of in Laredo back in 2015 talking to Customs and Border Patrol agents, and they said that what they've seen is that the illegal drugs, so heroin, comes across the border there and it goes up the interstate, so up 95 to northern New England, up 35 through the middle of the country. And so that's one of the ways that it gets spread. But no, make no mistake, this is a national challenge. And even though we see it worse in small states because we know everybody, if you look at places like California and New York and Pennsylvania, it's a huge problem there as well. So I think that's part of my belief that we've got to provide additional resources for communities.
Senator, thank you. Going to echo everyone. Thank you again. My name is Jesper Vandenberg. I'm from George Mason University, their international security program. I had a quick question on looking forward to America's next potential epidemic. And I was wondering if you could speak to any of the policies in place or skills that we've picked up to make sure that, when America faces its next healthcare crisis, we, stop it before it grows to the level that the opioid epidemic is at.
No, I don't have any. As I said, one of the things that I think is most effectively addressing the opioid epidemic that I do think applies to future crises is recognizing that this is not a siloed problem, that you can't say this is just a medical problem or this is just a law enforcement problem, or this is just an education problem, recognizing that it all overlaps, and we've got to treat it that way. The best way to deal with this opioid epidemic is through prevention, through making sure that prescribing changes, the way we view pain medication or opioids is different, to make sure that we address the problem for kids in school at a young age so that they understand there are other options, making sure that people have health care and mental health care, so when they have a problem, they can go and get help. And I think that applies to whatever emergency we might have.
And for one more.
I was in drama. I was just wondering,
well, I can't tell you what's happening across the country. I can tell you what's happening in New Hampshire. We have a federal prison in the state, and we now have a we have a treatment program in that federal prison for people with substance use disorders. We have a number of county jails that have been very effective in providing treatment programs for people and in getting them signed up, recognizing when they're going to get out of jail and making sure they're signed up for expanded Medicaid so they don't lose the treatment when they get out of jail. And that's one of the huge problems. I had a doctor write me about a patient that she had been treating who came to see her who had gotten, he had been getting health care and he got arrested and was in jail. He was going to get it out of jail, and he came to her as soon as he got out. She couldn't get him into a program fast enough, and he overdosed. And making sure that people know where to get help as soon as they get out is really critical. And as I said, we're having some success with that. It's slow, and we're learning, but it's very important that we do that. And listen, one of the things that I know everybody in this room knows, but it's important to remind people, these costs aren't just to the person who has the substance use disorder and their families. These are costs to the community. The cost of the opioid epidemic in New Hampshire is billions of dollars a year because of lost productivity, because of other challenges with law enforcement and with treatment. So these are costs to all of us, and it's in all of our interests to address this problem in a way that reduces the human toll in the future.
That's all the time we have. Please thank Senator Shaheen, and I'll hand it back to Johanna. Thank you so much.
Thank you.